certainly not since I've been CEO. We've never had trouble drawing down on our grant.
President and CEO Lori Dwyer says on Monday, Penobscot Community Healthcare attempted to take money out of its $5.6 million federal-based grant, which is annually funded by HRSA, also known as the Health Resources and Services Administration. Dwyer says that attempt has been flagged for review, and HRSA isn't communicating with them as to why.
We really don't have an explanation for why this is happening. I do know it is happening to other health centers across the country.
While only comprising around 5% of its total revenue in a given year, Dwyer says those funds are often accessed and primarily used for basic operational costs in its employees' biweekly payroll.
We don't have a lot of reserves, so that's a really stable source of funding for us, and we rely on it. That's really what created the crisis.
Dwyer says an exact plan is not in place, but if this issue isn't resolved by their next pay cycle, then they'll have to find savings in the amount of 25% from their payroll.
Doesn't necessarily mean 25% of our workforce, but that's the target in terms of a cost reduction.
If furloughs do occur, Dwyer says it would be non-patient facing jobs.
The goal is not to interrupt patient care, but to look to behind the scenes administrative and other types of positions like that. I need to say that it's not because those other positions aren't critical to operations, they are.
Despite this crisis, Dwyer remains hopeful that's only temporary.
We intend to be here for the long haul, but this is a crisis right now.
Doug Banks reporting for ABC 7 and Fox 22 News.